In today's video, I'm going to tell you what cancer rehab is, specifically oncology physical therapy, what a cancer rehab provider can help you with, what to expect at your visits, and why every cancer survivor should have one on their healthcare team. I'm Dr. Alex Hill, your physical therapist for everything oncology and pelvic health. Let's get into it. Cancer rehabilitation is focused on improving and optimizing physical function before, during, and after cancer treatment. There's more and more research supporting the role of physical therapy for people living with cancer, but unfortunately, many people still aren't aware that PT can help decrease the severity of side effects from cancer and cancer treatment. Oncology PTs have the typical training that all other PTs have, but they also have additional specialized training specifically for working with cancer survivors. This allows them to provide safe and effective treatments regardless of where you're at on your cancer journey. Now, let's talk about what oncologies can actually help you with. Because the effects of cancer and cancer treatment can be experienced during treatment, days or weeks after treatment, or even months or years after treatment, PT can help at all time points throughout your cancer survivorship, starting really from the point of diagnosis. There are various areas within oncology that PTs can specialize in, from working with kids who are living with cancer to treating lymphedema, working with people who are actively getting treatment in the hospital, and everything in between. Since I treat adults in the outpatient setting, meaning a clinic that you would go to, I'm going to be focusing on commonly seen outpatient conditions. This is not an all-inclusive list, but the more common diagnoses and symptoms related to cancer and cancer treatment that I see. These include lymphedema, pain, weakness, deconditioning, decreased range of motion and flexibility, trouble with mobility including walking, balance issues, pelvic health issues, radiation fibrosis, chemotherapy-induced peripheral neuropathy, axillary web syndrome, scar tissue, and fatigue. So what should you actually expect at your first visit with an oncology PT? Well, at the initial evaluation, a thorough discussion about your medical and surgical history, as well as all the specifics about your past cancer treatment and history, will be performed. It's important to bring the following information with you to your first visit to help your therapist: your previous or current cancer diagnosis, including the stage, previous or current cancer treatment, any upcoming cancer treatment, and your cancer survivorship plan. Your oncology PT will ask a lot of questions about your symptoms, and they can include: what are the main problems and limitations that you're having? When did the symptoms start? What makes your symptoms better or worse? And a whole lot more. After the subjective is done, a physical musculoskeletal exam is performed, which may include looking at your posture, functional movements like squatting, lifting, bending, getting in out of a bed or a chair, strength testing, flexibility, range of motion, joint mobility, balance, sensation, reflexes, your cardiovascular fitness, and checking your skin and tissue health, especially if you've had radiation or a surgery. Once that general exam is complete, an additional assessment for lymphedema might be performed. A lymphedema exam can include measuring the affected areas like the arm, the leg, the head and neck area, the chest, or the abdomen. A thorough assessment of these tissues and the type of swelling to determine the stage of lymphedema or how severe it is will be performed. Check back next week when I talk about what lymphedema is in a new video. The type of interventions and treatment that you'll need with your oncology PT depend on your symptoms and the examination findings. Treatments that you might have include a lot of education, complete decongestive therapy, which is the gold standard treatment for lymphedema, stretching and mobility exercises, strengthening and stabilization, pelvic floor exercises if you're having pelvic health concerns like leakage, hands-on manual therapy, balance exercises, training for orthotics and prosthetics, and job duty retraining as well. Because this is still a small but fast-growing specialty area, it can be difficult to find a qualified therapist. The American Physical Therapy Association, or APTA, has a great Find a PT tool to find one near you, and the American Board of Physical Therapy Specialties also has a search tool to find a board-certified oncologic physical therapist. Finally, the Lymphology Association of North America, or LANA, also has a tool for finding specialists in lymphedema treatment. So I'll include the links to all of these sites for finding physical therapists near you in the description below. Make sure to subscribe to my channel and turn on notifications for new oncology content.